Hi guys, my name is Kate O'Sullivan. I'm going to be presenting my project. My topic is scoliosis in adolescence, how it develops, the causes and impacts of it as well. So kind of just to give an overview of what I'm going to be going over, I'm going to overall cover what is scoliosis in general, some symptoms that are signs of scoliosis development, correlation between adolescence and scoliosis, and along with, these are kind of overlap, but the effects of scoliosis on adolescence. And then I'm also going to cover the treatments and preventions that are put in place to help those with the diagnosis. Okay, so to begin with, what is scoliosis? So adolescent's idiopathic scoliosis is an abnormal curvature of the spine that appears in late childhood or adolescence. Scoliosis can develop at any time in someone's life. However, it is more common for it to develop during adolescence, which I'll go over in a second about why. And it also is just more common to be caught in adolescence. Or later adolescence. I'll go over that as well. So these curves can be an S or C shape. It basically literally means that your spine looks like a C or an S. If you have an S, then you have two curves, top and bottom, and then a C, you only have one big curve. The image that I offered here, you can kind of see where our normal spine would be, and then the one next to it, that's the development of a C curve. And you can see that her hips and alignment is all thrown off because of it. The reason that it's more common for scoliosis to develop during adolescence is honestly primarily due to the growth spurts that we do have during these time periods. For girls, we went over it in the module, but for girls it's between 8 and 13 years old, and boys it's between 10 and 16. And because of this increase in growth rapidly, our bodies kind of aren't ready for it, and sometimes that can just lead to the development of the scoliosis. It's actually both amount common in boys and girls. It's the same level of commonness. However, it is much more common for it to become more severe in girls, to where you might need surgery or some sort of treatment plan. The curve just basically will continue to become progressive and become more severe with time for the most part. However, it's less common for guys, but it'll just keep going. There's not really a stop for scoliosis. However, it can go really slow and you'll be fine for some people. So symptoms and causes. So some symptoms, obviously we all probably got checked during probably middle school and elementary school, where they have you bend down and you see that. However, a lot of times it goes unnoticed during those things because adolescents are going through that time where they're self-conscious, leading them to avoid form-fitting clothing. So a lot of times you actually parents will miss it, friends will miss it, doctors will miss it, and you can't get early diagnosis simply because you're not wearing form-fitting clothing, so they can't see that your hips and everything is offset. But some things that can show signs of scoliosis development include uneven or tilted shoulders, prominence of ribs on one side, so it pops out a little bit more because you're crooked, uneven hip level, higher hip on one side because of that, uneven waistline. The hips are a huge factor, along with why it could become more severe for girls as well, because during this time of adolescence with the growth spurts, we're also going through puberty and developing hips and everything that it all is getting kind of just happening too much at once. Some causes. So idiopathic literally means the cause is unknown. So there is no direct cause of scoliosis. However, it's ultimately believed to be resolved a combination of these factors: genetic, environmental factors, hormonal problems, abnormal bone or muscle growth. So genetic, approximately 30% of patients with scoliosis have family history of this disorder. So it is pretty common for, if someone in your family had it, that you'll probably develop as well. But that could also have to do with the fact that genetically your growth spurts and your height that you grow is part of your family line. And then kind of went over what I was talking about, how it's more common for females is the hormonal problems. Hormones can affect everything basically, so it can lead to the development of it increasing. However, although they don't know the direct cause of scoliosis, they do know that it's not related to a specific behavior activity. So you're not going to get scoliosis from wearing a backpack that's too heavy or having poor posture, which is a myth. Okay. So correlation between adolescence and scoliosis development. So kind of what I went over earlier is the growth spurts during adolescence that we experience. This can be a huge factor of why someone might have scoliosis or develop scoliosis. These growth spurts just happen too fast, and so a lot of times our alignment is thrown off, or if genetically they already have it set in stone, and then the growth spurt all leads to it. And body image issues and body dissatisfaction. So I kind of also covered this a little bit earlier, but during this time, we went over this in the module, but our body image issues are pretty heightened during this time. So it's easy for adolescents to not want to wear like form-fitting clothing because their body's like completely changing and different. This can lead to people not finding out that they have scoliosis, so early diagnosis is hard, and then it becomes that you have such a severe scoliosis and it's caught before you can go through any of the treatment that could have slowed it down in any way. And then another factor is just the fact that scoliosis ultimately increases body image issues in general because it is such a physical disorder and so apparent when you have it, when it's severe. Similar to the image I provided here, this is a very severe scoliosis, but that's basically what they're checking for when you bend over, is that like heightened thing. But you can see that this could probably decrease your quality of life in some form, especially if you're going through the changes already, and then on top of it, you're having this change. And then something I personally did for the research of my project is eating disorders during adolescence in relation to scoliosis, because to me, I had scoliosis I got diagnosed when I was 12, and then I eventually needed surgery when I was 17. And I felt like there's probably a correlation between eating disorders and scoliosis, simply because you're already going through such a unhappy time with your body that like you're going to have a urge to do more of those type of habits. However, actually doing my research, I found that surprisingly, there's not a direct correlation between the two. However, scoliosis does lead to ultimately a decrease in quality of life and body dissatisfaction. Those factors can eventually lead to an eating disorder development, but there isn't like a direct correlation between the two. But there is actually a correlation between females with anorexia nervosa. They are much more likely to develop scoliosis, simply because of how their body is lacking muscle and stuff to keep things in place. So when they're growing, they're just like growing, you know? So yeah. And then some treatments. So how it goes for scoliosis is there's various factors that will determine if you're able to get treatment, what treatment they're going to advise, etc. These factors include the location of the curve. So depending on where your curve is, it can be in the upper part, like up here, or lower or lumbar. And where this is will kind of let the doctor know what they want to do, because if it's in like the lumbar area where your hips are and stuff, you're not really wanting to touch that area too much because you can become pretty immobile with your hips and you don't want to get too stiff. Severity of the curve. So how they base this is all the curves are measured by degrees. Straight is 0, and then as it increases, a curve develops. However, a lot of times people don't realize, but it's kind of normal to have some slight curve in your back. It's when you get to those degrees, such as like 20 or like anything probably higher than 10%, is when you're starting to look at maybe, okay. Honestly, anything higher than 20%, you're starting to look at maybe this is scoliosis. But it is normal to have slight curvature in the spine. However, once it starts actually being a curve, that's where you have a problem. But these curves are basically how they tell whether or not you can get surgery and everything like that. Child's age and number of remaining growth years. So it's really important that during treatment plans that someone doesn't get it before they're done growing. This is unless it's mandatory, simply because once you do these surgeries and stuff, there's no more growing that's going to happen. You're going to be that height for the rest of your life. And so if a child's like 12 when they get developed and they have such a severe curve that it's in the point where they need surgery, it can be almost, they're going to be that height. In fact, they actually will grow from surgery because your spine's internally like this. When they straighten it, you actually grow in height. I actually know from my personal experience, I grew 2 inches from mine. I was already tall, but I grew to be 5'9" simply from the surgery. So the options that you're going to have for treatments is non-surgical and then surgical treatments. These non-surgical treatments are going to be observation. This is when a curve is less than 25 degrees. This is kind of like when you get caught with it at the beginning. If you catch it early enough, this is where it should be. And they'll probably just be like, okay, we're going to sit and watch this, see how it goes, see if it increases, see if this is something we need to worry about, or if it's just a slight curve in your spine you can have for the rest of your life. Now, the next option is bracing. This is for between like 25 and 45 degrees. I actually did go through bracing from the age of 12 till around 16, and then surgery 17. Because once they developed that, when I was 16, they found out I could get surgery. So once they figured that out, they kind of are like, okay, until the surgery, you don't need to wear the brace. Like, what's that going to do now? But bracing is not a cure. It's simply kind of like a retainer. You're just going to wear it at night. Some doctors do advise people to wear it during the day. I didn't have to do that, but a lot of times it'll look similar to the image I provided. My one looked almost identical, hot pink as well. And it's kind of like a retainer where you're just going to wear it at night to kind of slow down the progression of this curve. This can help with like when a child has a lot of remaining growth years left, so that then they can grow this height and it's progressing slowly, but it's still progressing, possibly. Maybe it's not, but it's not going to put it backwards. Like, it's not going to fix the curve. Now, surgical treatments. This is a pretty aggressive treatment. It's spinal fusion. This is for degrees more than 45 to 50 degree curve. I actually included my own personal, that's my x-ray, post-surgery. And basically a spinal fusion, what they're going to do is they're going to use bone marrow graft. Mine was from I forget where they got it from, but I'm pretty sure mine was from my ribs, like parts of my ribs. And they use a bone marrow graft from your spine and different parts. And they basically fuse your back together with metal rods and your spine and screws. And then you basically have a straight spine for the rest of your life. But that's how people grow from it and everything like that. Sorry, I have a little bit of cold. And then an overall summary of what I presented. So scoliosis is common for adolescents to experience. Even though this is something that people can experience at any stage, it's much more likely for someone to experience it during adolescence than any other stage. It's also 2 to 3% of people in the U.S. in adolescence develop scoliosis or get diagnosed with scoliosis. This can be due to various factors, including the growth spurt that we go through during puberty. It also is a result of genetic, environmental, hormonal, and body changes that can occur. Even though the actual reasoning is not known, it's never going to be something that's known. It's not a very easy thing to figure out. There are these factors that can definitely play into part with it. And the treatments for this disorder include both surgical and non-surgical options for those suffering with it. Here are my references. And then thank you guys so much for listening. Hope you learned something. And yeah, bye.